Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about frequently asked questions about medical coding. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. I've been a medical coder for over 10 years. I created my channel with the hope of sharing all the things that I know with all of you, from the tips and the tricks and all the stories, so that you know what it's all about, at least from my experience. So do me a favor, hit that subscribe button, hit the like button if this video helps you, and at the end, if this video helps, I hope that you will share it with your friends. Okay, so let's get started. Now, these are my most frequently asked questions. I've done a video like this before, but I keep getting a new batch of like a lot of the same asked questions. So I thought I'd go ahead and do another video. The first frequently asked question though is, I want to start as a medical coder, but I don't even know where to begin. If you are interested in becoming a medical coder, you need to go through either the American Health Information Management Association or the American Academy of Professional Coders. I will be leaving both links for both of these websites down in the description box below. But if you're interested in becoming a medical coder, you need to be certified through one of these associations, and they have their beginner entry level credentials. With AHIMA, or the American Health Information Management Association, it is the CCA, or the Certified Coding Associate. If you are wanting to go with the American Academy of Professional Coders, it is the CPC, or the Certified Professional Coder. And brand new coders with AAPC will have a -A after the CPC. This just means apprentice. It means that you have little to no experience. But there are things that you can do to have that A removed, like going through their PractiCode program on their website, or getting experience and then just doing a few other steps. It's all detailed on their website. So, but yes, I will begin there. So if you're interested in becoming a medical coder, those are the two associations you want to go through, one or the other, okay? Don't get both of them. If you're brand new, don't get certified through both. All you need is one credential to start with, okay? And then you can worry about getting more credentials. If you are looking to get certified through some other association that I did not mention just now, you are probably wasting your time. If you look at the job listings for medical coders, they're looking for AHIMA or AAPC credentials. I'm just saying, okay? So that's my first one. The next one is, can someone take an exam to be a CCA or a CCS without taking a course and just take the exam? So the CCA is, of course, the Certified Coding Associate through the American Health Information Management Association. The CCS is the Certified Coding Specialist. This is the gold standard of all medical coding credentials, because this medical coding credential says that you can code both inpatient and outpatient. And most either say either or, okay? Some are just outpatient credentials and some are inpatient credentials. And then of course you get the specialties, but we're talking about that right now, the CCS. Now with the CCS, you have to have certain educational requirements met, and they are listed and detailed on the AHIMA website at ahima.org. That's AHIMA.org. Now, if you want to go through their coding basics course, they do have an online medical coding program called the Coding Basics Collection. It should be up and running. It had been on repair, but I think it's back up and running if I'm not mistaken. However, if you are interested in taking their online program, please make sure that you call the customer service hotline before you try to sign up, so that way you can make sure that it's up and running. I will leave the link for the Coding Basics course down in the description box below, because I do realize that it is hard to navigate the AHIMA website. So finding it is a little bit hard for people. So it's okay. I will go ahead and leave it in there for you guys, so that way you have access to all of that. But yes, that Coding Basics course does meet the requirements for the CCS, the educational requirements. However, because it is inpatient and outpatient, they typically want you to have experience as well. So you will have to make sure that you confirm with them. Otherwise, if you are brand new to this field, then you're going to want to go with the CCA or the Certified Coding Associate. There is nothing wrong with that credential. There are plenty of positions available for that credential. If you take the time to look on any job listing website, like Indeed or something like that, you will see that there are plenty that are looking for that credential as well. So that answers that one. Next question. Should I start with a certification or should I get my degree? It's going to depend on you. So for some people, they don't want to be in college for 2 years, because if you go to a HIMA approved program, and both of the degree programs are only approved through AHIMA, the American Health Information Management Association. I always feel like I need to say that. But the degree programs are with AHIMA only. AAPC does not have degree programs through colleges, okay? They have the RHIT, which is the Registered Health Information Technician, AHIMA does. And that is the 2-year associate's degree. They also have the Registered Health Information Administrator, and that is the 4-year bachelor's degree, okay? So that is with them. If you go through one of those programs at your local college, make sure that it is approved. It is AHIMA approved, because otherwise, then you're just, you just have a degree in health information, and it's not going to help you if the place that you are requiring to get hired on, is looking for an RHIT or an RHIA. So make sure that you choose carefully your degree program if you choose to go that route. If you don't know anything about medical coding, and you've heard about it and you want to get into it, but you're trying to decide whether to go college or certification, my strong recommendation is to go the certification route first before you go and get yourself into a lot of debt for school, because degree programs are very expensive. I have heard from a lot of people who said that they could not get a job with their degrees, so they just gave up. That's a lot of money to just give up and just not have anything from it. So because of this is why I always tell people, go the cheapest route possible, which is to get your certification. It is a few $1,000s. The program for AHIMA is just under $3,000. Same thing with AAPC. So they have their online programs, and if you're interested, you can go through those. I would strongly recommend that you go through the association websites. However, there are trade schools out there, and the trade schools are a lot more expensive, whereas you can go directly through the associations themselves for a fraction of the cost. So I recommend that you guys do your research when it comes to finding out which school you want to go to, but decide which association you want to go with first. And that is your first step, to make sure that you know, because AHIMA has their benefits and AAPC has their benefits. So it really is all going to depend on what you want to do as an individual, and how much you are willing to invest your time and energy into learning. Okay, so even with the credential programs, you are still getting everything that you need to learn your basics from these courses that are online. And then, it's all up to you from there. So it is not easy to get a job the first time out when you are a brand new coder with no coding experience. And I don't know why this is, but this is just a fact of life for all medical coders. We all went through this. If you get discouraged easily, know that it is not you. It is the industry itself. So you have to do a lot of things, because medical coding will fight you before it lets you in. It will do anything and everything that they're not going to hire you, or they won't give you a chance, but you have to stay persistent and you have to keep applying. One of the other frequently asked questions is, everybody's asking for 1 to 3 years of experience. I don't have any experience. What do I do? You still apply anyway. Now, even when you are applying at places where you physically go, like a doctor's office or a hospital, this is what you have to do. You have to still apply with them anyway, even if they're asking for 1 to 3 years of experience. The only time, because you may be able to get a job, okay? They may be willing to let you in. Sometimes companies get desperate and they will take a chance on somebody that's brand new, okay? But the only place that you are not going to get in, there's a very high probability that you will not get in your first time out of the gate, is to have a remote medical coding position. It will not happen. They don't hire brand new coders to be remote medical coders, because you are going to want to be around other coders, other veteran medical coders when you first start, because you will have questions. Coding from the book and coding in the real world is two different things. So you're going to have somebody there with you to ask questions to. So if you are interested in it because of that, I want you guys to be aware. I'm not trying to discourage anybody from doing anything that they want to. I'm just telling you that with remote medical coding, you will have to have experience. But if you're going to a facility or a doctor's office or a hospital, then you have a chance of getting in there. Even if it says 1 to 3 years required, you still apply anyway. Do not let that stop you from applying. Another thing to keep in mind is that a lot of times it's not listed as medical coder. It's listed as something else. It's listed as medical office tech, or medical records tech. It is listed under different things, different titles. So be sure to look through and read, because a lot of times you'll find those that say brand new medical coders accepted. So there are those positions out there. You just have to look for them. Okay. So somebody else was saying that I heard from my Facebook medical coding group that people who have been looking for years and can't find jobs in medical coding. I'm scared. So the thing about it is, there's many reasons why some people are not able to get jobs. Yes, it is difficult for all medical coders in the beginning to get a job, but you still are given an assessment test when you are applying for these jobs, these medical coding jobs. It happens to everybody, regardless of experience. Even me as a veteran medical coder, I still have to take assessment tests whenever I apply someplace new. So whenever this does happen, sometimes if a coder did not do well, of course they're not going to get a call back. Or they're going to be told that no, they don't have enough experience, and that to get some experience and to apply again. So it really is going to depend on the background of the person. Did they pass their assessment test when they were applying for these jobs? What does their resume look like? How did they look when they were going in for the interview? If you are going in with the jeans and a nice blouse, unacceptable. You need to have on slacks. If you want to wear slacks, you need to wear slacks, or you need to wear a skirt, or you need to wear a dress, and the skirts need to be to the knee length. Okay. Or if you're wearing a dress, same thing, to the knee length. You need to look professional. And that is something that I talk about all the time. You need to look professional. You need to make sure that you look sharp. Okay. That is the only thing that it stops some people. Okay. Because how you look and how you're presenting yourself, it does matter. You're working with educated people, and these educated people have very short tempers, and they do not have time for you to be wasting their time. You need to look professional. So that's all I'm going to say about that. But don't worry if you have tattoos. That's a common concern. Just cover them up, okay? If you have them on your arms, make sure that you're wearing long sleeves. Nobody needs to see all your tattoos, okay? If you have piercings, facial piercings, you need to get them out of your face. A lot of times in hospitals, facial piercings, or even doctor's office, facial piercings are not allowed. Your nails, your fingernails, make sure that they are clean. Make sure that they are short. They cannot be all this long, weird, curly stuff, or these weird, flashy colors. They need to be red, or they need to be like a soft pink or something. Don't go with purple and blue and all green and all neon kinds. Don't do that, okay? You need them to notice your brain. You don't need them to notice what you look like, okay? And it's not to deter you from being creative with how you're expressing your outward look. But at the same time, you need to let them know that you're there for business. If this is your first job, then you need to let them know that you're there for business. If everybody else in that department is wearing jeans and a t-shirt, it does not mean that you need to follow the pack. You can still be dressed well, and you can still dress nicely, because believe me, people are noticing what you're doing. And if it's not your coworkers and the people that you work in your immediate department, it's going to be the other providers, because they're going to want to look for somebody that is looking professional so that they can converse with if they have questions. Okay. So that's all I'm going to say. And you have to be prepared for that. So make sure that you are well dressed. And yes, I know clothes cost money, but there are ways to get them cheaper. And I still do need to do a video about fashion for the office. But I will be doing that once this pandemic dies down and we can go back into the stores. I'll probably do something then. But keep in mind, there's always sales, there's always coupons, and there's those kinds of things. So you don't have to break the bank to get a bunch of new clothes, okay? And I never pay full price for clothes. I always look for deals on clothes, okay? Because I just happen to love clothes. Anyway, next question. But yeah, that answers that one. What are the production standards like? So production standards from all medical coders are different, and it's going to go based on the facility, and then it goes down to based on the specialty. If you work in a very high volume, straightforward, very easy, because it's the same thing over and over again, those kinds of clinics typically have a higher production rate, okay? You don't want to look for the easiest clinics so that way you can get all of your experience. Because if you do that, it's not going to help you later on down the road when you are 3 or 4 years in looking to go to another job and you've only done like PT and OT. Or you've done some other clinic that is a lot of the straightforward same thing. So you need to make sure that you are getting a lot of experience wherever you can. Be willing and let them know that you are willing to go to other different clinics and go to different specialties because you want to learn, okay? And show that fearless attitude, because the more experience you get in the different clinics, the better and more well-rounded you will be. And that is what you want, because high caliber, well-rounded medical coders are valuable. And that's what you want. That is definitely what you want. But it's going to take you, and it's going to take a commitment on your part as far as like continuing to want to study and continuing to want to learn different things, because what you learn in school is just a fraction of what you're going to learn, even when you get out into the real world. I'm just saying. But yes, the production standards, they can range anywhere from 85 to 150. And with inpatient, inpatient has different standards. They have, that you have to code, 2 to 3 charts per hour. But there's no telling how many encounters are in those charts. So yes, it may be like 2 to 3 charts, right? But it's based on a chart for inpatient is however many days that patient stayed, okay? So sometimes if a patient stays for 5 days, that's 5 days of encounters that you've got to look through, or rounds that you've got to look through. And or if they stayed there for 20 days, well, keep in mind you still got 2 other records to code. You know what I'm saying? So how long did those patients stay? So in actuality, you may be having to code in a sense, like what did I say, 20 and then 5 and then like another 10, so like 35, in 1 hour. So and don't get excited. Not everybody has it where it's like that. Okay, that is just an extreme circumstance. Okay, but I want you all to know that this is what is possible. You're looking at all of these documents, you're looking at 35 days worth of encounters total for this 1 hour, but it is going to average out, because there are going to be some hours that you're going to be able to code more, and there's going to be some hours that you may code none because you're still working on one record. It all depends on what's going on. Okay, so it is an average. It is usually based on an average of however many it is. If your quota is 100 per day, let's just make it even and simple. You're on the outpatient side and you have to code 100 per day. But let's say, for instance, you did 80 on Monday, okay, and then you did 100 on Tuesday. Okay, well, you're still 20 in the hole. Okay, so when they average out your production, it's not going to show that you are at 100%. Okay, it's going to show that you're right in the middle. Okay, you've got this deficit going on because the average is 90 now. Okay, you're averaging 90 from the 80 to 100. You're averaging 90. Now, if you go the next day and you do 120, now you've just made up for that first day deficit. Okay, so because you just made up for that first day deficit, in these 3 days, you're averaging 100 per day. So you're meeting production standards. Now, in the beginning, when you're brand new and you're getting hired on, they will give you a ramp up period where you have time to learn the ropes and learn the computer systems and everything else, and to be able to get your production where it needs to be. If you are on your phone, which drives me nuts, and I hate seeing coders on their phone, get off your phone. You are there to work. If you are on your phone, you are not going to make production. If you are talking with your coworkers because you want to chit chat and visit and talk about your old man, talk about your old lady, or talk about your kids, guess what? You're not going to meet production. You're there to work, and you're there to learn and make sure. Your extra time should be making sure that you fully read and understand what you're doing. Okay, and it's not always going to be like this. Sometimes it'll be real easy and you can meet your production and everything's real good. But just because you meet your production in one day, you meet your quota, and you have a couple of hours left at the end of the day, doesn't mean you need to goof off. It means you need to continue to work, because there's going to be those days when you're not going to meet production, and you're going to need to fall back on those days when you did a lot more because, maybe something was easier or something. So that is something to keep in mind. But yes, when you are in the work environment, make sure that you are concentrating, especially in the beginning, when you're trying to learn a lot of new things, because everybody is going to be watching to make sure that, is this new coder really applying themselves? Don't get scared. I'm just saying, I want you guys to be aware, because sometimes not everybody that talks to you is your friend, okay? And I want you guys to know this, because sometimes, new coders, when they come into new places with veteran coders, and sometimes veteran coders, they're gonna not want to help you or they're not gonna want to answer your questions because nobody helped them. So it's really going to depend. So like I said, not everybody is going to be, excited, but you got to make sure that you still have a positive attitude anyway. Okay. And you got to make sure that you are doing your research before you ask questions. Don't go running back and forth to your coworker every time you have a question without showing that you've made some effort to look up the answer on your own. If you've tried to look up the answer on your own and the answer still doesn't make any sense to you, then obviously, then you can go clarify with a coworker, whoever you need to ask, whoever is assigned to answer questions. But make sure that you are doing your part, and make sure that you are looking to see if you can find the answer on your own. And when you go to ask your coworker a question, show them where you've been looking to see if you can find the answer. Okay. That way they know, okay, this person is really trying. Let me help them. Okay. So that's my advice on that one. How long does it take you to code a record? It depends on the record. It depends on the encounter. It depends on what happened. Some are more complex than others. I happen to work in the orthopedic clinic, and I work in the podiatry clinic as well. So I see a lot of injuries. And sometimes I get patients who've come in who've been in a car accident or some other accident, and they've got multiple injuries. So it takes a little time. I can get through a record anywhere between 5 to 10 minutes, sometimes less than that. It just depends on what's going on. If it's a straightforward aftercare visit, sometimes it's not that long. Sometimes it's just reviewing to make sure, and then adding whatever I need to add as far as like diagnosis wise or procedure wise, and moving on to the next one. So it's really going to depend. As you get into it, the longer you are in it, it will get faster. Okay, so not to worry. If you're going slow in the beginning, it's okay. We all went slow. But you will get used to it, and you will get faster as long as you are doing the things that you need to be doing in order to get faster. Okay. I'm a mom. Is this a good field for me? Of course. All the women that I worked with when I first got to my first job were all mothers, and they were all mothers to little kids. So yes, this is a good field for mothers. This is predominantly women. So trust me, they understand when, you have your kids and they need you. So they get it. And it's really going to depend on you, as you're showing responsibility, that they know that you're not trying to take advantage. Okay. Let's see. Oh, are you on the phone a lot is another frequently asked question. No, I am actually not on the phone a lot. It's very rare that I'm on the phone. Most of the communication that I do is in person, face-to-face, or through email. Currently, because I am working at home right now because of the pandemic, it is by email. I do get some phone calls sometimes, but most of the time it is just by email, or when I'm at the hospital, it is face-to-face. I prefer face-to-face rather than email a lot of times, because emails can be misinterpreted very easily. Okay, there's no inflection in emails, and a lot of times, people can take things the wrong way. So that is why I like to go to them face to face if they have time, or if I see them, or if I can catch them, and it helps to build that relationship. I talk about building relationships with providers quite frequently because it is important, and it is one of the things that we as medical coders are not trained on when we are, learning medical coding, because we're learning medical coding, so we're not learning these other parts of it that would make us more successful. The better the relationship that you have with your provider, the more you communicate, the better off you'll be. And so don't be afraid of them. Be a partner to them. I talk about this a lot. Be a partner to them. It is important. And a lot of times they've never had this. So you going above and beyond is a good thing. Okay, so that is something to keep in mind. Okay. And are there still jobs? Now, I don't know why somebody would ask that question, but yes, there are still jobs as medical coders, even for brand new medical coders. Like I said, there is a way to look them up. You have to look them up under different names. Sometimes it is records tech. Sometimes it is medical office tech. It is going to be labeled under different names as well. But yes, you can look in any job listings and see for medical coders if they're still hiring for medical coders, in which they are. So that's it. Those are the frequently asked questions for at least for now. But thank you to everybody who's been submitting questions. I really appreciate it. I am loving the growth of this channel. If this video helps you, I hope that you'll share it. If you are interested, I do unofficial exercises, coding exercises, where I break down and I explain different coding scenarios. I also do crossword puzzles on my Patreon page. This is all on my Patreon page. And the beginning pledge levels is $1 per month. So if you're interested, I will leave the link down in the description box below. And I will go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.